Hello, I'm Dr. Graham Good. I'm the Deputy Medical Director at Blackpool Teaching Hospitals at NHS Foundation Trust, and I'm here with the weekly COVID update on the 21st of July 2021. Dr. Jim is off for a couple of weeks with a well-earned break, and it seems like an awfully long time since I last did this talk when we had COVID numbers of 0, and obviously now we have an increased transmission of COVID in community. A large increase at that, so that Blackpool now are at 795 per 100,000, Fylde 739 and Wyre 741. This is translated into hospital admissions going up. We currently have 30 COVID positive patients in the trust, 3 on our high dependency unit, 2 of which are unvaccinated, and 30 across Lancashire in critical care areas, particularly problematic in East Lancashire and Preston. Sadly, we've had 2 deaths in the last week, taking our total to 773. Another concern to us is we've had an increase in the rise of COVID positive patients in pregnant women who are unvaccinated. This is partly due to some concerns amongst the population of pregnant women of infertility and also issues around harm to babies, which is unfounded. So as you will see from data from the NHS website, it is perfectly safe for any woman over 18 who's pregnant to be vaccinated. And this is particularly important because pregnant women often have a worse form of COVID, particularly in the last 3 months of pregnancy. And indeed, we've had 2 patients recently who've come in, had to have emergency sections and have ended up on high dependency. So it's really important for women over 18, pregnant or non-pregnant, to get vaccinated to avoid these serious complications. Vaccinations have been a real success story across the world, and particularly in the UK, and it's why we've not had the exponential and large increase in rise in hospital admissions and deaths that you'd expect from this high level of COVID in the community. So it is important to get your vaccines. Everybody over 18 has now been offered the vaccine. Here in Blackpool we have a vaccine van. Tomorrow it will be at Blackpool Zoo, but if you go on to the council website, blackpool.gov.uk, they'll tell you there where the van will be. You don't need an appointment, so it's really important that everybody gets vaccinated. Go on the site, go and find the van in your local area, and they can deal with probably the best part of 100 patients a day. Obviously it's great news that the restrictions have been lifted, the sun's shining and everybody's enjoying the sunshine. In hospitals we are still sticking to mask wearing, washing hands with hand gel and social restriction to 2 metres. That's because we have a number of vulnerable patients, as you'd expect, in the hospital that we want to protect. So that when you do come up to the hospital, don't be put off that there will be security at the front door who will ask you to put hand gel on, put a mask on before assisting you to find out where your clinic or your destination will be. As you're probably aware as well, we're currently suspended visiting apart from a few key groups such as end of life, maternity and children. Another thing I'd like to add is it's really important for everybody to attend their appointments. We still run at something like 8% of people who don't attend their appointment, and particularly because we're in what we call a restoration phase of getting on with our diagnostic tests, our operations. Don't waste your slots. That's important. If you can't attend, please let the hospital know so that we can actually fit in another patient. So I'll sign off now. It's just really important to carry on being careful. There's an awful lot of COVID out there. So in terms of washing hands, wearing masks indoors is still a sensible thing to do if the ventilation's poor. So stick to the common sense, and I'll see you next time.